Cold season is here, so I'm gonna let you know which supplements are worth taking. Hi everyone, welcome back to my channel. In today's video, I'm going to be reviewing some of the top trendy supplements that a lot of people take for cold season, and I'm going to let you know which ones are actually worth taking and which ones you can save your money on. But before we start, it is important that I do a very quick disclaimer. Obviously, this video is for educational purposes only, and I am not your personal dietitian or medical provider. So for things like this, please make sure that you consult your individual healthcare provider for personalized advice. Beyond that, hi, my name is Katey. I'm a registered dietitian and certified personal trainer. My goal with this channel is to help you learn more about nutrition, fitness, and wellness so that you can be your best, whatever that looks like. I also love to do product reviews, so if you have any products or supplements that you want me to cover, just let me know in the comments below. All right, so let's get started. The first supplement we're going to take a look at is vitamin C. Vitamin C is a very, very popular supplement and nutrient that a lot of people take when they have a cold. And most people associate vitamin C with immune health. Obviously, you can get vitamin C through food, but there are also a ton of different brands out there that offer vitamin C, especially during cold season. One you might be familiar with is known as Emergency. And the reason why people take vitamin C supplements, especially when it comes to our immune health and for preventing and treating colds, is because of the close link between vitamin C and playing a role in our immune health. Also, during a cold, our vitamin C levels do decrease. So it makes sense that taking a supplement to increase our vitamin C levels would potentially prevent and treat a cold, right? Well, we have a recent 2023 meta-analysis that helps give this answer. So there was a 2023 meta-analysis published in BMC Public Health, and they reviewed 10 randomized clinical control trials. They wanted to see if supplementing with doses of upwards of 1,000 milligrams of vitamin C, so a pretty high dose, would reduce cold symptoms and their duration. And this study looked at two main outcomes, so how long the cold lasted and the severity of the cold. Based on these results, we see that sick days was 15% lower in those that took vitamin C. We also see significantly fewer days of severe symptoms, and the overall severity of symptoms was lower too. However, with that being said, for those that really only had mild cold symptoms, vitamin C supplements didn't seem to have an effect. We also see that the severity of symptoms was significantly lower in the vitamin C group. However, the total duration of the cold, so how long from start to finish a person had a cold, did not differ between those that took a vitamin C and those who did not. So while we do see a decrease in the number of sick days, and what a sick day means is missing work or school, we don't necessarily see a decrease in the length of the cold, but rather how many days you actually have such severe symptoms that you have to stay home. It seems that people can return back to school or work a lot earlier when taking vitamin C because the severe symptoms have gone down and now they are mild. Ultimately, the authors concluded that vitamin C supplementation did decrease cold severity by about 15 to 26%, but it didn't shorten the cold itself. So you may have a cold for, let's say, 5 days, and whether or not you take a vitamin C supplement, it's going to last about the same length, but let's say only 2 of those days you have really severe symptoms when taking the vitamin C versus maybe, let's say, 3 when you don't. They also did argue that those who interact with people who really get sick often, so for example children or other populations, maybe someone who works in a hospital or around sick people, may benefit more than the general population in terms of taking a vitamin C supplement. So what can we even take away from this study? Well, we do know that vitamin C is very important for our immune health, and based on this study, it does seem that supplementing with vitamin C does decrease the severity of symptoms. Beyond this though, there isn't a lot of data that suggests taking really high doses of vitamin C helps to actually prevent a cold from happening, and there are very few studies on this. Considering vitamin C is a water-soluble vitamin, our body will utilize what it needs and then it will excrete the rest through our urine. So taking really, really high doses when you don't necessarily need it is a little bit pointless and a waste of money. Considering the mass majority of the year we aren't actually sick, it doesn't make sense that you would be taking such high doses of vitamin C that our body's probably not going to be using every single day of the year. Instead, it's probably actually best that you focus on meeting the daily requirement of vitamin C, and then maybe when you have a cold, you could try to up it a little bit. And it really isn't that hard to get enough vitamin C in our diet. So the RDA for men and women for vitamin C is 90 milligrams for men and 75 milligrams per woman per day. If you do smoke, then you need to increase this by 35 milligrams a day. Honestly, as long as you're getting a couple different vegetables and fruit in your diet on a daily basis, you probably do get enough vitamin C. Just to put this into perspective, one red bell pepper has 95 milligrams of vitamin C. A lot of people associate oranges with vitamin C, and it does have a decent amount. So a single orange has 70 milligrams, and a third of a cup of orange juice has 93 milligrams. And there are a ton of other really great sources of vitamin C as well, including papaya, kiwi, grapefruit, cherries, rose hips, guava, cantaloupe, lychees, Brussels sprouts, broccoli, and many, many others. So really it is best to focus on getting vitamin C through your diet majority of the time. And maybe if you are experiencing a really severe cold, maybe bumping up your vitamin C, whether that's through food or through supplement, could potentially be a good idea. If it is through supplement, of course, you should run it by your doctor first. With that being said, fortunately, vitamin C has low toxicity, meaning that the high dose that a lot of these supplements have likely don't have any negative effects for the average person. So what we can say from this is really, if you have really severe symptoms during a cold, then maybe supplementing with vitamin C can reduce it a little bit, but not to a really dramatic effect. But in terms of preventing a cold from happening, there really isn't much research to support it. Okay, so now we're gonna move on to elderberry. Elderberry has been around for a long time, but it has soared in popularity over recent years as another way to potentially prevent and treat colds. And for those of you that don't know, the elderberry is simply a type of berry that grows on elder trees. Like most berries, elderberries are very high in anthocyanins, which have anti-inflammatory and immunomodulating effects, meaning that they support our immune health. Elderberries also have a decent amount of vitamin C and other anti-inflammatory properties as well. So what we want to know is, will supplementing with elderberry decrease the risk of getting a cold? Will it decrease its symptoms? And will it decrease the length of the cold or its duration? Fortunately, there was a 2021 meta-analysis that looked at this. In this review, researchers looked at any type of study that looked at supplementing with elderberry in terms of preventing or treating colds as well as different infections. In this review, they also looked at different studies that looked at elderberry by itself, as well as combination treatments, meaning that elderberry and other ingredients. Also in this review, any dose was included. Unfortunately, because elderberry isn't as popular as other supplements, there aren't as many high quality studies, which is why the researchers only had a couple to look at. And depending on what they were trying to look at, some analyses only included one study. In terms of preventing a cold from taking elderberry, there was actually only one 2016 study that looked at this, which found minor improvements. From the study, they did find that cold duration decreased by an average of 2 days in those that took elderberry supplements, and the severity of symptoms was also lower in those that took elderberry. With that being said, even though a reduction of 2 days and the severity of symptoms going down is impressive with taking elderberry, the authors do caution before we jump to conclusions about this, because this study did have some limitations and flaws, and again, it is only one study. Other studies found significant improvements in flu recovery after supplementing with elderberry for at least 3 to 4 days, but there were no improvements after only 2 days, so it seems that you have to take it for a couple of days to start seeing the effects. And they also found that those who took elderberry seemed to recover about 2 days faster than those that didn't take elderberry. Again, the authors in this study really want to highlight the risk of bias, so we have to be careful with interpreting these results and making big, bold claims at this time. Based on all of this, the authors concluded that supplementing with elderberry doesn't seem to actually prevent a cold, but it may decrease its duration and severity of symptoms. So again, sort of similar to what happens with vitamin C. So what we could take away from this is that it may decrease the duration, it may decrease the symptoms a little bit, but the evidence is not convincing at this time. With that being said, elderberry syrups and supplements, when they are taken in the doses provided by the manufacturer, appear to be pretty low risk. So that's good to at least know that if you did want to try it, that it does appear to be low risk, at least for the average person. In terms of the best dose, there really doesn't seem to be enough research to provide that at this time, so just follow what the manufacturer says or what your healthcare provider tells you to take. So next we're going to look at vitamin D. Vitamin D is one of the most popular supplements out there, and a lot of people take it. And most of us do know that vitamin D is known as the sunshine vitamin because we can synthesize it through our skin from sun exposure. But unless you live near the equator, access to strong sun exposure is not a guarantee throughout the entire year. And because of this, a lot of people do have lower vitamin D levels during the winter. If you live in a northern country like I do in Canada, then it is likely that you probably have lower levels in the winter too. Now, technically, vitamin D is a fat-soluble vitamin, meaning that if we have any extra, we do store it in our fat cells. However, as the months go on and we have less and less sun exposure, our body will use those stores, and as a result, our levels start to go down. Now, considering vitamin D does play a key role in our immune health, a lot of people do want to take vitamin D to support it. Fortunately, because because vitamin D is so popular, we do have quite a bit of research on it. So first we have a 2021 meta-analysis published in The Lancet, so this is a well-regarded journal. And this study looked at 43 randomized control trials with about 48,488 participants, so this was a pretty large study. When looking at all of the different studies on supplementing with vitamin D and in participants that reported at least one acute respiratory illness, we do see an 8% decreased risk of acute respiratory illness in those that supplemented with vitamin D. However, when you break it down by the study, there actually aren't that many significant results, with the exception of a few. In studies that looked at people who were deficient in vitamin D and took a supplement to increase their levels, the studies did see a decrease in the number of respiratory infections. And this does make sense. If somebody is deficient in vitamin D, then their immune function may not be working its best. So supplementing with vitamin D to increase your levels back to what they need to be likely will help our immune system do what it's supposed to do, and therefore decreasing the risk of getting sick. However, those who had adequate vitamin D levels, meaning that they didn't have a deficiency, there were no significant differences in terms of getting sick or not. They also found that taking vitamin C on a daily basis seemed to have more benefit than taking it on a weekly or a monthly basis. The authors did point out that there was a lot of heterogeneity in terms of the studies, so they aren't apples to apples comparisons, which makes the analyses hard to do. Overall, the authors did conclude that while taking a vitamin D supplement did decrease the risk of respiratory illness, especially in those that were deficient, the risk reduction for the average person is pretty small. However, the research is quite mixed. If we look at another 2022 meta-analysis published in the Frontiers of Nutrition, so another good journal, they found that supplementing with vitamin D led to a 22% decreased risk of getting the flu. In addition, they found that supplementing with vitamin D in the winter months was most effective, and this does make sense. Again, in the winter time, we don't have as strong of sun exposure, so our vitamin D levels aren't going to be naturally as high. While this is promising, there were some limitations, so they didn't look at the appropriate dosing, so they didn't look at which dose would lead to the results and which wouldn't, and some of the studies didn't have baseline vitamin D levels. So it's challenging to know if the person really needs to be deficient in vitamin D to see benefit from supplementing with it, or if somebody who has okay levels of vitamin D will still benefit from taking a vitamin D supplement in terms of reducing the frequency of getting sick. Finally, we have another meta-analysis from 2022 that looked at over 30 randomized controlled trials that found no improvements with supplementing with vitamin D in terms of reducing respiratory illness. However, like the other study, they didn't look at baseline vitamin D levels, and the authors did suggest that if somebody is deficient in vitamin D, then supplementing with vitamin D to increase their levels back up to normal likely would lead to improvements in immune function. So based on this, it seems a little bit confusing because there are so many different studies that are telling us different things. And the reason for this is because it depends on the study design and what the authors wanted to use in terms of their study criteria. So some reviews may have looked at studies that had to have baseline vitamin D levels, while other ones may have not. Also, if you noticed in some of the studies, I say that they looked at just respiratory illness, or those that just looked at the flu, or those that looked at colds in general. So these are all technically slightly different, and as a result, they may have different outcomes. What we can say from this is that if you have low vitamin D levels, then it is very important to bring them back up. Oftentimes, this is done through supplementation because one, a lot of foods don't have high vitamin D levels with the exception of a couple, and you'd have to have quite a bit to really increase your levels. And then two, we don't always have adequate sun exposure. So supplementing with vitamin D is an effective way to increase levels. In terms of dosing of vitamin D, this is a bit of a gray area and it is a highly controversial topic. As it is today, the RDA for vitamin D is 600 international units a day. For people over the age of 70, the dose does go up a bit more. So at least taking a vitamin D supplement that provides at least this minimum dose is a good option. However, most vitamin D supplements provide usually much higher than this. I find the average one for an over-the-counter vitamin D supplement is about 1,000 international units. So while the research is a bit mixed in terms of reducing the frequency of colds and preventing them, what we do know is that vitamin D is important for supporting our immune health. And for the average person, especially in the winter months, it is a good idea to supplement with vitamin D. And that is general advice given by most health organizations, especially if you don't live near the equator. And considering a lot of people are at risk of a vitamin D deficiency, it might be a good idea to supplement with vitamin D, at least in the winter months. And I personally do that myself. Okay, so now we will do some rapid fire supplements, particularly covering Echinacea and Zinc. So we aren't here all day. I wanted to cover a couple other supplements that are very popular that people take in terms of preventing and treating colds, and that is Echinacea and Zinc. So first of all, Echinacea has been used in traditional medicine for a very, very long time in supporting immune health. To date, the research is pretty mixed in terms of whether it works or not. While there aren't a lot of studies on Echinacea, there was one 2019 meta-analysis. Researchers found that supplementing with Echinacea was only effective in reducing the risk of getting an upper respiratory infection. But if somebody was already sick, supplementing with Echinacea was not found to be effective in terms of reducing the symptoms or the length of the sickness. And from all this, the authors concluded that they aren't convinced that Echinacea really does much, especially because there aren't a lot of studies available available, and the studies that are available do have a lot of flaws and limitations. That being said, some people do still want to try Echinacea when they are sick. It does appear to be safe for the average person, especially when taken in a short duration. Finally, we have zinc. Now, zinc is a very important mineral and antioxidant that we definitely do need for our health, and it does play a key role in our immune health. So a lot of people do take zinc to help prevent a cold as well as treat a cold, but does it actually work? Well, fortunately for zinc, we actually have a Cochrane meta-analysis, which is considered a very high quality review. And this review came out this year and gave us the answer we're looking for. So in this review, they looked at 34 studies that had over 8,500 participants, so a pretty decent size. In this study, they wanted to look at two things. First, they wanted to know, will taking zinc help prevent someone from getting a cold? And two, will zinc supplements reduce the length of a cold? From this review, they found that supplementing with zinc did not decrease the risk of getting a cold. Find that supplementing with zinc did seem to decrease the length of a cold by about 2 days, but the evidence was pretty weak and not something that we should be totally confident in at this time. So based on this review, it's not convincing that you really need to take zinc to prevent a cold, and in terms of treating a cold, it could potentially decrease the duration of the cold by a little bit, but we do need more research on it. But that doesn't mean zinc isn't important in general. So the RDA for zinc is 11 milligrams for men and 8 milligrams a day for women. Fortunately, you can get zinc through a lot of different foods. So for example, oysters, beef, pork, fortified cereals, different poultry like chicken and turkey, beans and lentils, and whole grains. If you do choose to supplement with zinc, it is important that you stay under the upper intake level unless otherwise advised by your healthcare provider. Because the thing is overdoing it with zinc can lead to some unwanted side effects. So for example, stomach upset and nausea, and it can also decrease the absorption of some nutrients like magnesium. So for the average person, it's probably best to actually prioritize zinc-rich foods rather than a supplement, and making sure that you're getting enough on a daily basis. The thing is though, is just in terms of actually taking a zinc supplement in reducing your risk of a cold and its duration and symptoms, there just isn't enough high quality evidence at this time to really recommend it as a treatment. And with that, I hope you found this video helpful in terms of learning more about different supplements and how they work in terms of treating colds. As you can see, the research is very mixed when it comes to this because there's so many different types of sickness. People's immune systems do work differently, and also we do have different levels of these nutrients naturally. So it is a little bit mixed in terms of the research, and so really the best thing you can do is focus on a nutrient-dense diet first, doing other lifestyle factors that can improve our immune health as well, and then maybe supplementing with different things as needed. In another video, I'm going to provide a list of different lifestyle things that you can do to support your immune health. So make sure that you subscribe to my channel so you're notified when that comes out, and I'll see you in the next video.